It was when a family member was suffering in hospital with cancer that I was watching what the nurses were doing. It was quite inspiring. I think it would be nice to be able to give back to the NHS that does so much for us already. I think I enjoy nursing the most because no 2 days are the same. You never know what's going to happen from one day to the next, and I think there's no sort of set job you have to do. I've been lucky enough to have medical, surgical and community placements all in first year, and I think that just highlights the variety of jobs that you can go into once you're qualified.
Well, the barriers for men, a lot of it's down to the general stereotypes that men aren't meant to be nurses. You know, it's a very female-orientated profession. But other than kind of that stereotypical thing, I think there's a lot of problem with education, and people don't actually realise there are so many different branches of nursing, and actually there's a branch of nursing, or there's a type of nursing for everybody really. It's a very, very, very diverse field. On placement, I've never really experienced any misconceptions about my role. I don't think predominantly people see me as a male nurse. I think people see me as a nurse, and I take that as a compliment.
Only 10% of the workforce for nursing are male. It's very much a bit more stigma that men don't do nursing, and we're trying to bring more males into nursing. Definitely enjoying my training. I like the wide variety of learning disability, as I get to work with children and adults and work with people who have a learning disability from profound and severe right the way through to people who have forensic history and have come from the prison service.
I wanted to be a nurse because I like to be challenged, but also at the same fact, I think people with learning disability need a voice,